Hey, Renova friends, this is Kelly, and today I'm here with Dr. Brittany Newsom. Dr. Brittany, thanks so much for being with us.
Thanks for having me.
Yeah, so you're here in Texas. You have a very extensive background. Give us a little bit of your background.
So I've kind of gone all over the place in the last 5, 6 years of practice. Everywhere from a sports medicine equine rehabilitation internship in California, back to rural mixed animal practice here, small animal emergency medicine, and now doing GP medicine and equine sports medicine again on the side with two separate businesses. So kind of again, all over the place. I am a certified medical acupuncturist for animals, and I'm also chiro certified or getting my certification in chiropractic for animals.
Wow, that is a long list. And I know you also do a lot with sports medicine and rehabilitation, palliative care. Got just about all of it covered, which we love. Dr. Brittany, tell us about how you heard about Renovo.
So Renover is a product that I feel like is very well known in the equine world. I will say probably back in 2017 when I graduated, not nearly as popular as it is now. For my equine friends, lots of big names out here in Texas use it intravenously. We use it in joints all the time for these cases that are just chronic and we're trying to manage inflammation. I do feel like it's a product that became really well known in the last 5 years as well. So it's kind of hard to say where I heard it from, but I definitely hear it often from my colleagues and from representatives and conventions and so on and so forth.
Okay, we'll give a little shout out to Dr. Bigby also, who's our chief veterinary liaison, who you know.
Yes. Oh yeah, yeah. No, particularly Dr. Bigby, who I ran back into at the AAP convention in November. So he directed me back to you guys.
Well, he did come out of retirement for Renovo, so
Yes,
we're
he did.
thrilled that he did that. So, can you share a case with us where you've used Renovo?
Yeah, I've got a couple of cases. So I've got a personal case and then one that I would say is professional because it's not my own animal. I have an 18-year-old off the track thoroughbred who has had a very colorful career in show jumping, anywhere between coming up along the ranks at 4 and up into the meter 20s and meter 25s. She's been a great horse and kind of pulling her out of retirement over the last 4 years. Like most older horses who don't have a lot of maintenance on board. Little sore, a little creaky on top of body work and everything else. I felt like Renovo was a good option for her to kind of kickstart her career back after we get out of our little rehab space. So for her, we did an IV administration. I did feel in the 14 days or so later, she's not as short in the hind end as you're having issues with. She's much more apt to want to move forward. She's a lot more supple in the hands. And I'm not saying it's a miracle cure, but I can definitely tell that there's a huge difference on her saddle for her personally. She's also not as cranky as most thoroughbred mares are. She's pretty crotchety. And I do feel like some of that behavior has subsided as well. So it's hard to say whether or not that's hormonal or pain response. But, considering the fact that clinical picture is clinical picture, whether it's diagnostic or just what's seeing in front of you, and we're good at that. So for me, clinically, she's a much different horse. Professionally, I use it quite often in joints that I'm visiting the horse every 3 to 4 months for steroids intraarticularly. We've either switched over to other steroid products or other regeneratives, but I do feel like Renovo is a really good product as well because what it does is it definitely treats the inflammatory process and helps some of the breakdown of cartilage in these joints over time. So one in particular I can remember, she is a 10-year-old Dutch warmlet that I've seen very often. I've seen her kind of come along in her career, even personally. We've done fetlock injections on her left front consistently. She did have a history of an OCD that was removed. And she's one of those that we decided because of the frequency of intra-articular injections, we try some Renovo on her. And it was a huge difference in this, Mary. Instead of doing steroids every 3 to 4 months in this force, now we're gapping once a year as needed. It truly is a great product.
Wow, that's tremendous. Obviously, the less injections and the longer you can go and keep those results makes the most sense. We love that.
Yeah, yeah, for sure.
Dr. Brittany, what would you say to any vets who have not yet tried Renovo?
Renova is a great product. It's because it's an allograft, it makes it very safe. The protocols are out there for Renovo, which is nice. So if you're new to using it, there's plenty of us vets out there that have used it. And you can reach out to any one of us and we'd have no issues helping you through it. In my opinion on regenerative medicine, it's the future. Although the tried and true steroid and HA is always great into a joint, why not actually repair the joint so that we're having to do less long term?
Exactly. That makes so much sense. Where can people get in touch with you and find out more about what you do?
Yeah, of course. Thank you for asking. So we're on Facebook, Instagram, and our website. Our company's name is High Caliber Performance, and our Instagram handle is High Caliber Performance TX, but our website is www.highcaliberperformance.com.
Awesome. Thank you so much, Dr. Brittany.
Of course.